Blessed is the man that trusteth in the Lord, for whoso hope the Lord is. That is in Jeremiah chapter 17 verse 7. So welcome to this channel, and in today's lesson we are talking about learners with difficulties, that is the cerebral palsy. We are going to understand what is cerebral palsy, how are we going to support, and how are we going to empower such students in our classes. So what is cerebral palsy? It is a group of lifelong neurological disorders that affects a person's ability to move and maintain balance and posture. And it's the most common motor disability in childhood caused by abnormal brain development or damage to the developing brain before, during, or shortly after birth. So we can understand that it affects balance and posture of a person. So what are the causes of cerebral palsy? The brain damage associated with cerebral palsy can occur before, during, or within the first few years of life. We have the congenital cerebral palsy, the majority of cases, and it occurs before or during birth, often due to abnormal brain development, infections during pregnancy, or a lack of oxygen to the brain. Then we have the acquired cerebral palsy, which occurs more than 28 days after birth and up to a few years of age. And causes may include head injuries, infections like meningitis, or disruptions in brain blood flow. There is brain injuries before, during, or after birth, premature birth, and lack of oxygen to the brain. These are the causes that bring about the cerebral palsy. We have types of cerebral palsy, but today we are going to measure on the 4 types of cerebral palsy. So cerebral palsy, it is classified by the specific movement and coordination problem it causes. So we have the major. It is the spastic cerebral palsy, specifically affects the muscles, making them very stiff, that is tight muscles, hard to move, sometimes painful even to stretch, and jerky movements. So when you want to understand this, what will be the main features of the spatial cerebral palsy? The muscles are very stiff. There is hypertonia, like you can't even move a muscle, like it becomes so hard, like it's very hard. The joints are so tight, difficulty walking or balancing, and the most of the spatial cerebral palsy have scissor-like walking, that is the leg crossing, and weak and slow movements, and there are muscle spasms. So that is the spatial cerebral palsy. Then we have the dyskinetic cerebral palsy. It's a type of cerebral palsy where a person has uncontrolled involuntary movement because the brain has difficulty regulating muscle activity. Unlike spatial palsy, unlike a spatial cerebral palsy, the CP, the stiff muscles, this one is more about too much movement that the person cannot control. And what are the main features of the dyskinetic CP? We have sudden or jerky movements. A person it starts from nowhere, right? Then slow twisting movements, difficulty holding postures, let's say like sitting, standing, it becomes very difficult. And the movements that get worse when trying to do something purposeful, and you will also realize that there is a problem with speech because facial muscles are affected in this dyskinetic CP. Difficulty swallowing in some cases, and damage to the part of the brain. In this dyskinetic CP, it is mainly caused by damage to a part of the brain called the basal ganglia, which helps control movement. Then we have the ataxic CP, and it affects balance, coordination, and depth perception. The ataxic cerebral palsy, it's the rarest form of cerebral palsy, affecting only 5 to 10% of people suffering from this disorder. The severity of the ataxic cerebral palsy is generally determined by the level of the brain damage sustained. And although some types of cerebral palsy are recognized soon after birth, but the ataxic CP tends to become noticeable a little later, often between, let's say, 6 to 18 months of age. So a person with ataxic CP may have poor balance, falls easily, unsteady walking, that is like wide-based gait, shaky movements, difficulty with fine motor skills, that is writing, buttoning clothes, let's say even drawing, then problems controlling hand movements, and speech that may sound slow or scan. Then we have the mixed cerebral palsy. This is a combination of two or more. There is maybe spastic and dyskinetic, or dyskinetic and ataxic. That is the mixed cerebral palsy. So in order for us to distinguish them from each other, you'll understand that spastic cerebral palsy, it has stiff muscles, dyskinetic CP and control movement, and ataxic CP, there is poor balance and coordination. So in the characteristics, you will just notice that there is difficulty with movements and coordination, speech difficulties, slow writing and fatigue, possible learning challenges in classes. So what are the symptoms? The early symptoms of cerebral palsy. Symptoms range from mild to severe, and usually appear during infancy or early childhood. The condition itself is non-progressive. That is, the brain damage does not worsen, though symptoms may change over a lifetime. So what are let's say the first one, we have the developmental delays. That is, being slow to reach milestones like rolling over, sitting up, crawling, or walking. Then we have the muscle tone abnormalities, that is, the limbs appearing overly floppy or unusually stiff. Then we have the movement issues, that is, favoring one side of the body, poor coordination, or difficulty with fine motor skills. Then we also have the secondary complications, that is, difficulties with swallowing, that is, say, speaking, vision, or learning, as well as potential seizures, disorder, or chronic pains. So when we talk about the management and support of these kids in classes in our inclusive classrooms, so while there is no cure for CP, early interventions and multidisciplinary approaches can greatly improve an individual's capabilities, independence, and overall quality of life. And we have the classroom environment. We should use supportive chairs for posture, remove obstacles and clutter, and according to the teaching strategies, we should give short and clear instructions, break tasks into smaller steps, and on the physical, let's say, assessment adaptations, we should allow oral instead of writing, give extra time in tests, and also reduce writing, communication, and collaboration. Like, use simple language, allow gestures or common aids, be patient during response, encourage peer communication and support, and on the emotional and social support, encourage and praise effort, promote inclusion with peers, and avoid highlighting limitations. And when we talk about collaboration, work with parents, involve therapists, that is the physio, the OT, the speech therapist, share progress regularly, and team-based support approach is mandatory here, like it's critical. So in order, because learning, we are not looking at what you're doing, but we are looking at including all these two students in our class in order to support them so that they can also be independent at the end of the day. Otherwise, I hope you liked this video. Please share and like the video. All right.